Hi everyone, welcome to the Empowering New Nurses Show. I'm Dr. Miriam Smith, DNP. I'm excited that you have been following, and I've heard many comments, and I'm happy to know that in this way I'm able to serve in this capacity. Our new nurses, our young nurses, our seasoned nurses are following, are being interviewed, and are making a difference in this time. This month is being celebrated as Mental Health Month. We also have Nurses Week and Nurses Day. So I'm delighted and ecstatic to be able to pay tribute to our nurses who are serving in so many different capacities. We are happy that you have made so many contributions to the nursing profession. And to my young nurses, as you learn, just never forget that someone helped you along the way. And so pay back by being extra special in your delivery of care. Follow the guidelines, and of course, patient satisfaction will be realized. Today's episode is on mental health. And I just want to say what health is. By the World Health Organization, it's a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmities. My definition would be more inclusive in that, for me, health is complete physical, mental, social, and of course, spiritual well-being, and that not merely the absence of any disease or infirmities. So I know you might have your definition, the way you see health, but at the end of it, we're talking about total health, the entire being involvement. And so today, I just want you to think of the statistics. It has stated that just about 50% or more individuals in their lives have experienced some form of mental changes or mental situation or mental issues. So we can look at it from another angle by saying mental illnesses can contribute or cause or contribute to physical illnesses. By that I mean, if one is depressed, that depression may fuel or put someone at risk for maybe diabetes, cardiac diseases, or even a stroke. If we twist that around, a person who goes through physical illness, underlying illnesses long-term, might also be affected mentally by becoming depressed. And you know, depression, that's another form of mental illness and needs treatment. This episode will be short, however, I will continue because it's such an important topic that so many times have been stigmatized. And just as one has a physical illness, someone can also have a mental illness. And both need treatment. Both need help. All right? This mental illness can affect the way we think, the way we cope with situations, with relationships, on a whole, how we deal with each other. So it's very important to know that if one sees or knows of someone else who needs help, just as you would have said to the person with diabetes or high sugar, get some medical help, or even assist them in getting that help. The person with mental illness also needs, whether it's psychological help, that person needs treatment in order to be able to function well and be able to contribute to society. There are many signs and there are many organizations that are helping today. You can go online, you can look at Mental Health for America. You just look them up. You can look on the CDC website, and you might ask me what CDC means. Well, some people might not be aware of it, but CDC actually means the Centers for Disease Control and Prevention. And that's available on the web. You can look, you can research, and we have the internet at our fingertip, so we all can help one another. In this time of COVID, some have had residues after COVID, the fears, the death, the losses, all of those factors can actually affect our mental state, and we need help. If someone needs help, they should be help is available. So if you are scared, if you see someone that needs it, you can help assist that person where no man is an island, no one stands alone. Someone needs someone to help. And if you can be of that help, please do. I will continue in another episode on this very important topic. As we have the physical illnesses that need treatment, we also have the mental illnesses that need treatment, and we should act thus. Thank you so much today. Thank you so much today for listening and coming on this episode as we celebrate Mental Health Month. I am Miriam Smith, DNP. You can follow me on YouTube, Miriam Amanda Smith. On Instagram, Podcast Mir. On PodPal, Miriam Smith. On Facebook, Miriam Smith. It was just a pleasure serving and giving tips on mental health today. Let me hope you will say something to someone just in the event you observe that someone needs help. Make a referral to someone. A simple question as, how are you today? A cheerful word, a smile can make a difference in someone's life. I charge you today to do just that. Make a difference in someone's life by being an advocate for mental health. Thank you. Have a great day.